Thank you very much. I'm with People's Daily. My question is to Mr. Wu Hao. Right now, we are still in the midst of the COVID-19 pandemic, and we are witnessing constant variants, new variants of the COVID-19. And how do you evaluate China's efforts in fighting the COVID-19? And how do you evaluate China's policy of zero COVID? And what adjustments of policy can you expect going forward? Thank you very much for your question. Since the Wuhan outbreak, I have participated in the emergent handling of COVID-19 in 11 provinces. I have witnessed the pandemic, got involved in fighting the pandemic. I believe China's zero-COVID policy is the most effective and most responsible. China's dynamic zero-COVID policy is successful because we have the strong leadership of the party. We also have the staunch support of the general public and also the understanding of the people. It's also indispensable from the strong support in terms of science and technology. China's COVID-19 control is very successful in that it demonstrates China's advantages of its culture and political systems. It is fair to say so because each time when we are fighting the epidemic, we bear in mind the principle of putting people's life and health in the first place. We are constantly summarizing and adjusting our measures and policies. In the beginning, when we were in Wuhan, we put in place enclosed management and great management. We mobilized the party members to take the front line. Our party members and also medical workers rushed to the front line and served as a fortitude of defense against the pandemic. All the scientific and technological workers also joined with us. In June 2021, during the Xinfa epidemic, we put in place epidemiological surveys. We analyzed people's whereabouts and initiated the precise control of COVID-19. And last year, when dealing with the epidemic in Guangdong, we put forward such concepts of buffering zone and control area and restricted area. We're using health code to manage different categories of people, and different control policies are practiced upon different population groups. Last year, in September, when dealing with the epidemic in Xiamen, we used the National Land Resources and Travel History Survey for the first time, and we managed to control the epidemic in Xiamen within the first incubation period. And this is possible because we were able to leverage some of the most advanced technologies to effectively control the epidemic. And this year, there were some flare-ups of the epidemics in Beijing. We were also preparing for the Winter Olympics, and we used some electronic means to control the epidemic while not controlling the free flow of personnel. We very efficiently controlled the pandemic in Beijing. So from all this, you can see that we have been constantly adjusting our measures and policies. Going forward, we will follow the development of the virus and dynamically study the disease and coordinate our economy and different social sectors so that we can maximize the effectiveness of our COVID-19 control policies and also minimize the impact on society. In the meantime, I encourage all of you to develop a healthy lifestyle, improve our personal awareness in epidemic control, and let's join our hands together. I have confidence that we will weather through the storm and win the fight against the coronavirus pandemic. Thank you.